We are so excited to share this with you. As Ty just mentioned, for the next 7 days, get ready to travel with Ty and the Truth About Cancer team as they travel to and interview doctors, cancer patients, and expert researchers in Taiwan, Philippines, Singapore, Malaysia, Thailand, and India. Of course, the first country they visited was Japan, land of the rising sun. After a 14-hour flight from the USA, Ty and Bryce and the team arrived in Tokyo Narita Airport, caught an Uber to the hotel, and the first person they saw at the hotel was our good friend, Dr. Antonio Jimenez. To begin, here are a few interesting facts about Japan. The Japanese name for Japan is Nihon or Nippon, which means sun origin. Japan is made up of over 6,800 islands. Japan has been number one for close to 3 decades now, with an average life expectancy of 83.7 years. And there are more elderly than children in Japan. And finally, stomach cancer is the number one cancer in Japan. Are you ready? Please grab a notebook and a pen or your iPad and get ready to travel and learn alongside Ty and the Truth About Cancer team in Japan.
Our first interview is with Dr. Shin Akiyama. He's a medical doctor here in Japan, and he's with me right now. Dr. Akiyama, thank you so much for joining us today.
Very nice to meet you.
Yeah, it's very nice to meet you too. And if you could just share with us a little bit about your education here in Japan and what led you into becoming a medical doctor.
私は札幌医科大学を1989年に卒業しました。その後、化学療法の専門医として養成されました。10年前から免疫療法を始めました。特にデンドリティックセルベースメディスン。その後、6年前からがんの遺伝子治療を始めました。現在約30年間がん治療をしています。
Dr. Akiyama, I know that you speak English and Japanese. If you'd prefer to answer in English, feel free, and that'll be fine. And then if we need to, we'll just CC it on the screen. So, yeah, no worries at all. Now, Dr. Akiyama decided that he did want to proceed in English, and so the first question that I had for him was about the incidence of cancer in Japan.
In Japan, cancer patient has been rapidly increasing. The number one cancer patient is mainly gastric cancer, and next lung cancer, liver cancer, pancreatic cancer, prostate cancer, and so on. And as for female patient, number one cancer is breast cancer.
You said gastric cancer is number one. Why do you think gastric cancer might be one in Japan? Could it have anything to do with all of the raw fish that's eaten here, with the parasites perhaps?
Very good question. But I think the most influential factor is Helicobacter pylori infection, Helicobacter infection of gastric wall.
When Dr. Akiyama said that Helicobacter infection might be the reason for stomach cancer increasing in Japan, it reminded me of my father. He had stomach cancer, and I remember the doctors mentioning Helicobacter. When Dad got sick, we really wanted to take him to one of the alternative cancer clinics in Tijuana, Mexico, because the USA does not allow for many types of treatments since they are not FDA approved. So I was naturally curious what kind of freedom that doctors have in Japan as it relates to using treatments that might be thought of as unconventional.
Japan is such a good place to do non-conventional therapy. We have a Japanese law, Japanese medical law. We Japanese doctors can use almost anything. Why Japanese doctors think it is necessary for a patient?
So that's fascinating to me. That's a stark contrast from the United States. So in Japan, Japanese medical doctors are allowed to use whatever they think would work for the patient.
Wow. Now that is a huge difference between the USA and Japan. There is actually a Japanese law which allows doctors to use anything that works for their patients. In other words, in Japan, traditional Eastern medicine and Western medicine coexist in peace. This allows for doctors to be innovative and to utilize treatments that really work, even for the most difficult cancers, like brain cancer.
Now you're doing a unique treatment for brain cancer that I learned about, and it is using electric currents, tumor treating fields, right, to treat brain cancer. Talk about that if you could.
Because our treatment, cancer treatment field can also stop cancer cell cycle. It works to stop cancer cell cycle and then induces the apoptosis. It's very, very easy and convenient therapy. But patients have to wear a helmet like this for a long time, such as 10 hours a day also. Most of the patients treating by treatment field is end-stage brain cancer. But sometimes it works very quickly. Normal cell takes more than 3 or 4 or 5 days to divide into two normal cells. It takes longer. But whereas cancer cell, just from 10 to 24 hours to divide into two cancer cells very quickly. Because cancer cell divide so rapidly, mostly within 24 hours. So cancer cells are very vulnerable by tumor treating fields.
That's fascinating. Utilizing electric frequencies to effectively treat late-stage brain cancer.